Hello everyone, welcome to Move Well, Live Well. We've been having a number of people coming in with tightness in the hip flexors. They're getting spasms sometimes in the psoas muscle. It's a big muscle that helps to stabilize the trunk onto the lower extremity. It basically attaches the upper body to the lower body, and they're getting psoas spasm in through there. The psoas muscle helps to provide trunk flexion, also to provide hip flexion. So bringing the hip flexion, bringing the thigh up toward the trunk, as well as bringing the trunk towards the thighs. And what's happening is they're getting spasm in through there, and it's causing this diffused, crampy pain, sometimes radiating to the low back, pain sometimes going into the groin, can even go down the front of the thigh. So we all, in our lives now, we do a lot of sitting. So we're always in this contracted, shortened sitting position. So these guys, these hip flexors get super, super tight. And when we ask them to do any kind of work, they're already in this facilitated tight position. And then sometimes they can cramp up on us, causing all kinds of problems. So an easy way to help alleviate that tightness and spasm in through the hip flexors is to have a partner to help you stretch that, because sometimes it's very, very hard to stretch that particular muscle group by yourself with a lot of pain. So if you have a partner to help you with it, it's going to help provide that ease to let that muscle relax, and thereby decreasing that cramping and discomfort in that hip flexor. So we have Dr. K with us again here today to help us out. Hey, Dr. K, thanks for helping us out. And so we have Dr. K here lying prone or face down. You can use your bed, you can use your floor, whatever it may be. You have your superhero partner with you to help you out to do this. This is how we like to do the stretch for the hip flexor. You can do it in different ways, but again, the hip flexor allows you to do this. So we're going to do the opposite of that. We're going to do hip extension to stretch it. So I like to start out with first stretching out the quads in the front. So you have the patient here forward, and you're going to start out by blocking the sacrum here a little bit, and then doing a little bit of knee flexion, just nice and easy till you feel that tissue approximation with the calf and the hamstring. Nice and easy to stretch out the quad, the quadricep, which is the muscle, big muscle in the front of the thigh. So nice and easy, just like this. And I'm blocking here, because what tendency, if these people are tight in the front here, what happens if you do this, you can see her low back start to extend as we do this. It's very, very subtle, but you can see that low back wanting to extend right in there. But if we block this here right in the tailbone, we can eliminate that and put more of the pivot point in the hip flexor, or excuse me, in the hip rather than the low back. So just like this. As the patient or as the person gets comfortable with this, what I like to do to increase hip extension and to stretch out the hip flexors here, I like to use like a half foam roller. This is a half foam roller. You can use a pillow, whatever's comfortable for underneath the thigh, but you want to start off with something that's going to increase the distance between the thigh and the table or the floor. So we're going to put this underneath her thigh here, just like that. And now we're going to block it again, and now you can kind of see this hip is starting to go into hip extension. So this is hip extension here. And again, I'm going to just start with the quad. So again, I'm going to block here. I'm just starting with the quad, the quadricep muscle. So we're just doing knee flexion at this point. And now her hip is also in slight hip extension. So this is hip extension with knee flexion. And you feel that? Yeah? Mm-hmm. Yeah. And some people will be super tightened through here simply because we live in a world where we're sitting all the time. So that muscle just gets super, super shortened and gets super, super tight. And it brings all kinds of problems into your lives. So here we are. Now you can kind of feel, I can kind of feel that she's getting comfortable in this position right here. I can even have her contract, relax. I can have her push her thigh in toward the table. 2-3 seconds, relax. And now I can get a little bit more range here with the knee flexion. Again, I can have her push again, thigh in toward the table, and relax. And I can get a little bit more range in through here. Do this 2-3 times. Contract. Relax. Good. Nice and nice. And this is her right hip flexor that we're working on right now. How's that feel? Feels good? Mm-hmm. All right. And then have her relax out. She's gotten used to this. You can bring in, I'm going to take this out here. You can even bring a higher one. Grab this here. You can bring a full-on foam roller underneath, just like that. And now you can kind of see with the full foam roller here, you can kind of see, now we're in hip extension. We're really getting that hip extension. Again, you're going to block here, just like that. You feel that, yeah? Mm-hmm. All right, again, we're going to use the knee we're going to go in the knee flexion here. You feel that, and I can feel it start to block about right here. And just nice and easy. When it starts to stop, then I can again have her do a contract, relax. Go ahead and push against the foam roller. Good, relax. And push against the foam roller. And relax. And push against the foam roller. And relax, good. Good, and have the patient breathe. Have the person breathe. Good, we're going to let this come down just like this. And then you can test, after you're done, you can kind of test to see the improvements in hip extension. Now that you've relaxed the front, it's going to give you the ability to extend. Let me go in the front here. So since we live in a world that involves a lot of hip flexion, like this, now it's going to allow for hip extension since we stretch that out. So, here we go. I'm going to block this here. Go ahead and lift. This is the leg, the right leg, thigh. Hip is what we worked on. Let's have her raise up the uninvolved side, the left side. And we got about right here. Now let's go ahead and bring up the right side. And you can see we've gotten above my hand here to go with the right. So we've effectively, just temporarily, at this point, just by 2, 3, 4 minutes of working this hip flexor, we've gained about a couple inches of increased range with hip extension. So anyway, this is a nice easy way with a partner. Sometimes it's hard to relax to do this by yourself, and by having a partner, you can get that increase in range and decrease that spasm and tightness in through the hip flexors, the psoas muscle, thereby decreasing dysfunction in through there, and you get on with your lives pain-free. If you have any questions, feel free to drop them off in the comments. Please like, subscribe, and share. We appreciate you watching. Thank you. We'll see you next time. Bye-bye.